Welcome back to Our Issues Milwaukee. I'm your host, Andrea Williams. More than 1 million people are actually living with HIV in the United States, and 1 in 7 they're unaware of their status. My next guest is Crystal Collins. She is a registered nurse and project manager of the HIV clinic at Milwaukee Health Services Incorporated. Good morning, Crystal.
Good morning.
Thank you for being here. And when we look at those statistics regarding HIV infection, we're reminded how important it is for people to be tested and to know their status. This past week, we observed National HIV Testing Day, and like I said, 1 in 7 people are unaware that they are even infected, which causes about 50% of all new HIV cases. Talk about this and what can be done to help these numbers.
Well, I think it comes down to just awareness. I think a lot of people aren't aware of their risk. We kind of assume that people are in control of their health, that they're getting tested routinely, that they're talking to partners. But I think we, as the healthcare community, need to do a better job with marketing and just saying, hey, this isn't just a disease that affects a certain demographic or population, it affects all of us, and just making sure people have access to services.
Yeah, so is it true that African American women lead the numbers when it comes to HIV infection?
So African American women are amongst higher categories, but leading new cases here in Milwaukee, young African American males.
Wow.
And so African Americans and Hispanics make up 60% of the new cases.
Wow, so just 4 years ago, there were numbers that showed 87% of all people diagnosed in the city were among Blacks and Hispanics, like you said. Why are the people of color seeing higher numbers of diagnosis?
And I think it's the overall education, word of mouth in the community. I don't think that a lot of people know of, even though we work in healthcare and we know where all the access points are for testing, a lot of people, it's not known in the community. They think that, you know, you have to have insurance. And so sometimes just the knowledge gap, financial, really impacts people's ability to get tested.
And that's why it's important to have you here today. So the Centers for Disease Control, they recommend that everyone between the ages of 13 and 64 be tested for HIV at least once during their lifetime, and people at increased risk for HIV infection be tested at least once a year. So if you would clarify, what's that increased risk?
And I think increased risk has to do with if you have a HIV positive partner or if you've had sex without a condom and you don't know the partner's status. And so that can be any number of us.
Okay, that makes a lot of sense. So I think this is another thing that's important, is to let people know about what services exist that they can take advantage of, whether they have insurance or not. So if you would fill us in on some of the programs and services at Milwaukee Health Services Incorporated.
So Milwaukee Health Services service the whole spectrum of the population, from the women's health department and prenatal to pediatrics. We also have an internal medicine and family practice department. We have our HIV department, behavioral health and dental services on site, social service case management to help people get access to social programs, things of that nature. We have a WIC department on site, clinical pharmacy as well. We have an on-site pharmacy and radiology services.
Yeah, and you guys are considered, and I say this all the time, a one-stop shop, because a lot of times when someone is dealing with the symptoms of HIV infection, a lot of that has to do with dental.
Correct.
So if you have someone that is infected, you can send them right upstairs or to another facility to get that taken care of and make sure all of the doctors who are seeing this patient are able to communicate.
Absolutely. So it's a walk-in. We take walk-ins, And I think I want to go back to testing. The testing is very easy. It's a rapid test. We prick your finger, 20 minutes later, people walk out knowing their result.
Wow. And it is anonymous, so they don't have to worry about, you know, their name being put on file and things of that nature. You just let them know their status, because knowing your status is everything. Yeah, needless to say. What are the global issues when we surrounding STIs and awareness in the community?
So there was a news story earlier in the year. Milwaukee leads the cases in gonorrhea and chlamydia. We're number 1 in gonorrhea, number 3 in chlamydia cases. And so when you think about the reach of HIV in the community, it affects those very same people who have sexual transmitted diseases or sexual transmitted infections. And I think with sexual transmitted infections, that's the gateway to get them into the door and provide the screening. And just once you do that screening, you keep hammering home what risks are, making sure you give people what they need to protect themselves. And that's knowledge.
When that study came out, we had the health commissioner, Dr. Patricia McManus, come here to help us better understand those numbers. And we also had someone from the AIDS Resource Center to help us kind of break that down, because I think, like you said, it's one thing in hearing numbers, it's another thing in understanding them, and then what happens when those type of reports come out, people kind of add their own 2 cents to it, and then you have the miscommunication once again.
Yes, absolutely. I think it causes a lot of fear and panic, and then after the initial fear and panic goes away, it's kind of like it's forgotten. But you know, one of the things that we look at, National HIV Testing Day, it's not just one day. You know, we provide testing every day. You can walk into any community center and get testing.
Yeah, and one thing that goes along with this whole subject is the stigma and the discrimination that a lot of people deal with. So in your opinion, what does our society need to do in order to tackle that?
I think just be more accepting and open-minded. People come from all walks of life. People have different challenges that they face, but just treating people as individuals and listening to their stories, providing them with some of the essential services that they need in order to navigate some of the challenges in life.
Yeah, but you would agree that our society has come a long way since the 80s, when people really did make others who were diagnosed feel as if they were aliens. They were scared to touch them. They wouldn't hug them. So we've come a long way, you know, over the decades. However, we still have a long way to go, obviously.
We do. A lot of people see Magic Johnson, for example, and they say that, hey, he doesn't look like he has HIV, you know. And I think we have to take away HIV from having a specific face and just saying, it happens to a person, you know, no matter what you look like, no matter what color you are, it happens to everyone.
And a lot of people who are living with HIV right now, they are doing very well with the cocktails that are being provided. So Magic Johnson really was trying to do a service to the world when he disclosed that he was dealing with it. But like you said, a lot of people look at him and say, oh, well, he's all right. So, I mean, they don't feel like they need to take all the necessary precautions in order not to fall in that category.
When patients first are diagnosed, we talk about HIV not being a death sentence, and that, you know, HIV treatment is as easy as treating high blood pressure or diabetes. You take 1 pill a day, you can live an extra 30, 40 years when you're newly diagnosed, especially when we have some of the younger patients come in. Our highest cases are among Black males 19 to 24 years of age. And so it's just talking about how to change behaviors in order to impact and have a longer life.
So when you have conversations with that particular age group, where is their mind when dealing with this subject?
Honestly, a lot of them don't have experience with navigating the healthcare system. They don't participate in routine primary care. So it's basically meeting them where they are and just saying, you know, this is going to be a part of your life. We need to talk about how you will deal with this. And just, we're here to give you services. We have a case manager that we can link you with. If you have any challenges, let us know, and we can intervene in order to make you successful on this road. You know, we're holding your hand along this journey.
And that's what it's all about. And we have you here so that people can hear what you're saying and help spread the word. And if they know someone, then that automatically they know, hey, there's this place you can go.
Right.
That's really what we want to achieve. Some of the things that we've talked about during this half hour, our last segment was talking about lead exposure. And there at Milwaukee Health Services Incorporated, you guys have a plethora of programs and services, as we stated, and you also focus on really making sure the community has access to fresh fruits and vegetables. And you guys are going to be doing something really special coming up. It's a farmers market. Tell us a little bit more about that.
So we actually have a local farmer coming to sell different types of produce, fruits. He will be with us first and third Tuesday from 10 to 2. It's open to the public. Like I said, you can come get different variety types of produce, fresh vegetables, fruits.
Yeah, and it's all organic. That's, you can't get better than that.
Yes.
Again, that's on July 3rd from 10 to 2, and that farmer is the very popular Will Allen from Will's Roadhouse Farm. He's going to actually be there with his book, The Good Food Revolution, signing that as well. And as we wrap up, because we were talking about the lead exposure and absorption, there are some fresh, healthy foods that people can eat in order to help offset that exposure, right?
Yes, it is.
Okay.
And so you always want to incorporate fresh fruits, vegetables, foods high in protein, but particularly if you eat a lot of calcium-rich foods, so that's milk products, yogurts, cheeses. You're going to do the green leafy vegetables, collard greens, turnip greens, salmon. You're also going to incorporate iron, because iron helps block the lead from your body. And so those foods, beans, lean red meats, but also incorporating vitamin C found in citrus fruits, oranges, grapefruits, tomatoes, potatoes.
So healthy
peppers.
eating goes a long way. I
It
mean,
does, across
a
the
lot of us
spectrum.
are concerned on, losing weight, but really it just goes way past the outer appearance or the physical appearance. Really, it's essential for so
Correct.
many different reasons. I thank you for coming by and giving out this great information, and hopefully we can have you come back to give us more information when needed.
Absolutely, thank you.
Thank
you
you.
for having me.
Crystal Collins is a registered nurse and project manager of the HIV clinic at Milwaukee Health Services Incorporated. You can contact the MLK Heritage Health Center on King Drive by calling 414-372-8080, or you can go to their website at MHSI.org. That is going to do it for today's show. I'm your host, Andrea Williams. As always, thank you for watching, and I hope you join us again next week as we take another look at our issues, Milwaukee. Have a great day.